Hey guys, I just wanted to make a quick video, I hope it's quick, to talk about some of the comments that I've received with regards to some of the posts that I've made recently, and specifically people asking about, COVID and the COVID vaccines, and the people just wildly, randomly accusing all of this on being a result of the vaccines. That's not the case at all, and I want to make sure that we all have a firm understanding of that. The blood clots that have been found in my legs, in my lungs, that sort of thing, has nothing to do with COVID. It has nothing to do with the vaccines. It has to do with a condition that I've got called granulomatosis with polyangiitis. It's an autoimmune disorder that I was diagnosed with in 2016, and it's a vasculitis that attacks my blood vessels and tries to get my body to shut off blood flow to my organs. So and it does that in all kinds of different ways by constricting blood vessels, by causing blood clots, all kinds of stuff. It's my immune system thinks I'm the bad guy. So it is doing what it thinks is the right thing to do. Unfortunately, it is not the right thing to do because it's actively trying to kill me. This is a condition that I've had for about 8 years now. This is not new to me. This is pre-COVID. This is pre-vaccine. This is pre any of the conspiracy stuff that people keep trying to bring up in my comment section. I know I mentioned in one of the comments or in one of my recent posts that I recently got COVID and that it may have actually saved my life. And I want to explain that because I think it confused some people. Basically, I was leading up to like around Christmas and New Year's, I wasn't feeling well. And it was rough. I was having a hard time getting around. I wasn't moving well. My leg hurt a lot. And I talked about this in a follow-up video a week or two ago. And somebody mentioned, hey, that sounds like a blood clot. You should get that looked at. So anyway, finally went to the ER and they looked me over and saw that I had pneumonia. And that was part of the reason that I wasn't able to breathe well, is because my right lung was swollen up and infected and had all kinds of issues. So they admitted me. They gave me a bunch of antibiotics and steroids and all that kind of stuff to treat the pneumonia. And while I was talking to my pulmonologist, he's my lung doctor, I explained that leading up to this whole thing, I had spent a week with some pain in my left leg, and explained what it felt like and how it made me feel and those sorts of things. And so then he decided to do some blood work and some imaging and all kinds of stuff, and found the blood clot in my left leg. So we're going to pause there for a second. We have a blood clot in my left leg. Now, this is not my first blood clot in my left leg. It is not. I've had them before. In fact, in 2016, while I was hospitalized for 6 months, my legs were clotting while my lungs were hemorrhaging. Again, this is before COVID. This is before vaccines. This is before all of that. This is not my first rodeo. So they did what they could. They got all of that sorted. They had me on some blood thinners and some coagulants, and they had to find this weird balance to get my blood to the right consistency. They also placed what's called an IVC filter. Basically, it's a little hook that goes in your anterior vena cava, and it acts. It kind of looks like an umbrella without the material on it, right? And it's meant to capture any blood clots that you might throw before it goes to your heart and lungs and kills you. And I had that for a couple of years, and they removed it. Sorry, that's my kitty. He's coming to check on me. So I dealt with that for a period of time, and everything was fine. While I was in the hospital in 2016, I knew there was a reason I was talking about that. Dude, sorry. Here, look, do you want to say hi? Yeah, that's what I thought. Anyway, so while I was hospitalized in 2016, I had a bunch of lung injuries happen. I had what's called a diffused alveolar hemorrhage. So think of your lungs as being big sacs, right? But those sacs are comprised of millions of tinier sacs. And a diffuse alveolar hemorrhage is basically where a group of those rupture. And I lost about 30% of my lung capacity. My lungs look like absolute trash when they're imaged. because they look like hamburger. Everybody who has looked at an image of my lungs over the last 8 years has a hard time figuring out what's going on, because my lungs are so bad because of the diffuse alveolar hemorrhage. I also had one of my lungs collapse at one point, and they had to put a chest tube in to deal with that as well. So my lungs are fucked. So when I was hospitalized between the 11th and the 15th of January of this year, they did a bunch of imaging on my lungs. They did all kinds of imaging that they had never done on me before in an attempt to try to get the best images they could. What we wanted to do was a CT scan with contrast, because that's the best possible way to get the images that we were looking for. The problem is, because of the granulomatosis with polyangiitis, it has directly affected my heart, lungs, kidneys, and brain. Like I have damage to all of those parts of my body as a result of the GPA. We're just going to call it GPA instead of granulomatosis with polyangiitis. So because my kidney function, my GFR was at like 29, it was dangerous to do the contrast, because your kidneys have to filter that shit out once the imaging is done, and they didn't want to risk that. So they did all this other imaging, and they couldn't get good imaging of my lungs. So while I was there for that 4 days, I contracted COVID at the hospital. And I know this because for the last month, I've gone nowhere else. I've been sick. I haven't felt well. I haven't had the motivation to barely even go outside, let alone anywhere else. And even the doctors, the nurses, everybody's like, yeah, you probably got it when you were here last time. Even the ER doc who admitted me this time was like, yeah, you probably got it here. So I was supposed to go in the other day for a Rituxan treatment. Now, I've been taking Rituxan treatments about every 6 months for the last 8 years. It is a chemical compound that they inject me with over the course of a few hours, and its entire job is to literally just shut off my immune system, to keep it from actively trying to kill me. When I got there, like they asked if you had any hospitalizations or surgeries or any of that kind of stuff recently, and I told them, yeah, I was just here, a week ago for all this other stuff. So we went back and forth, and they had to call some doctors to make sure it was still okay for me to get this infusion, because they're going to shut off my immune system. But I'm also still kind of fighting pneumonia, and I'm fighting this and I'm fighting that, and they wanted to clear it with the doctor before they did, something that could make things worse. So they finally get to go ahead from the doctor, and then they're like, okay, well, let's do your vitals, make sure you're ready to go, and then once your vitals are clear, we'll get you going on this infusion. And immediately my oxygen saturation was at like 85. Anything less than 90 starts to get dangerous. And I had a fever of like 102. So they're like, yeah, we probably shouldn't do this. We don't feel safe. We don't want to risk your health to get this. And I was like, cool, I get it. It sucks. I really needed to get this done. I am past due, but fine. We rescheduled it. It's coming up in a couple of weeks. So I get home, and I message my doctor on the portal, and I'm like, hey, here's the deal. What do I do? And long story short, he's like, you should just go to the ER. They're going to get you taken care of faster than whatever I can do in clinic. You'll get better treatment there faster. Which I have mixed feelings on, but that's a whole other story. So go to the ER. They do a bunch of tests. They get me admitted. They do the nasal swab and find out that I've got COVID. And because of my extensive medical history, because of the spiked fever, because of the COVID, they're like, yeah, we probably ought to get you back into a room and get you the quick help that you need with intravenous steroids and antibiotics and all kinds of blood thinners and all kinds of stuff to help treat all of this again and see if we can't get you back on the right track. So they did. And while I was there, while I was in the, once I'd been admitted, they decided we're going to do another CT scan, but your GFR, again, that's kind of the number that tells the doctors what your kidney function is at. Originally, the other day, a couple of weeks ago, whatever, it was at 29, and that's too low to do a contrast CT. This time it was at 41, which is in a safe zone, so they did it. And then they found the blood clots in my lungs. It's called a bilateral pulmonary embolism, which means I've blood clots in both of my lungs. So we are actively managing that with blood thinners and steroids, and of course I'm on oxygen. If I'm not on oxygen, my oxygen saturation tanks, and I get really tired, and it's dangerous. So I'm on oxygen to help to help keep me alive, honestly. But walking from the front of my house to the back of my house, like when I sit down on the bed, and we're talking 20 feet, like I don't live in a big house, like sub 1,000 square feet, right? Small place. But walking from one end of my house to the other requires me to then sit and catch my breath for a few minutes. So I'm recovering, I'm doing okay, but I wanted to address the fact that this has nothing to do with COVID, and to bring that kind of back full circle. Because we shut off my immune system, because we shut off my immune system every 6 months, the Pfizer, the Johnson & Johnson, all of those different vaccines don't do anything for me because they can't, my immune system is shut off. My body can't take that information and build its own antibodies. Like it's not possible. I don't have an immune system to speak of. So the injections they weren't going to do anything for me. So instead, my doctors pushed to get me the monoclonal antibodies. And that's what I've been using since the beginning of COVID, is the monoclonal antibodies, not the other stuff. But it's frustrating that people seem to want to jump to, oh, well, you got this because of that. No, the fuck I didn't. You don't know my history, and that's why I'm trying to explain it right now. This had nothing to do with any of the Johnson & Johnson or Pfizer or any of that. This has to do with a pre-existing condition that I got years before COVID. So I'd like you to just kind of drop all of that. It's unnecessary. It's conspiratory, and I don't want to see it on my comments. I don't want to see it on my channel, because you don't know my condition well enough to tell me why I almost died. So if you want to talk about COVID conspiracies and that sort of stuff, do that on your page. Go ahead and just unfollow me, unsubscribe from me. Any kind of comments that I see like that moving forward, you'll just be removed from being able to leave comments on my page, because this has nothing to do with that. So anyway, I'm sorry for kind of the grumpy message, but it's too many people trying to tell me that it was because of the vaccines when they don't know dick about my condition. So take your conspiracies and go somewhere else with them, please. And again, if you can't do that, I'll happily do that on your behalf. And then you can talk all of the conspiracy stuff you want in the comments, but it'll never show up. So I think with that said, I'm going to go ahead and wrap this up and put something on the TV and just kind of hang out and enjoy my day. But to those of you with the well wishes and that sort of thing, thank you. I really do appreciate you guys. And I'm going to try to keep posting updates when I can. And I'll talk to you guys later.